They walk to school through ruins, and class is in a tent that teacher Isra Abu Mustafa built. Children have the right to education, she says, and to play and be free from fear. More potential pupils are receiving their polio vaccinations, but the fighting still rages. An Israeli airstrike on hospital grounds, killing at least 5. This mother says she thought they'd be safe. The death toll crawling towards nearly 41,000, according to the Gaza Health Ministry.
The single most effective way to address this particular urgent challenge of polio and all the humanitarian challenges in Gaza is to reach an immediate ceasefire.
An expert saying that's not likely.
Why we're seeing the pauses now is because viruses don't recognize nationalities or borders or politics.
Khaled El-Gindi saying Israeli Prime Minister Benjamin Netanyahu is likely allowing vaccinations now to prevent Israelis from contracting the virus. And Bibi has resisted renewed fierce protests calling for a deal.
Regardless of how many Israelis are in the streets, as long as there aren't 5 members of his coalition who defect, then he's not going to be movable.
Netanyahu's coalition includes the far right. El-Gindi says they'd only abandon Bibi if he does agree to a ceasefire. But a deal needs to be struck, he adds, because Gaza is now unlivable. The conflict stopped more than 600,000 children from going to school. Not all of them have teachers like Mustafa, who holds class in a tent. Nathaniel Dove, Global News.